about how doctors in rural areas or smaller towns, or they're not working at
Correct.
so the more so like benefits of coming to a conference like this, and then also other strategies to connect with doctors.
Yeah,
outside of
absolutely. So Binaytara, I think as a foundation, they've done an amazing job of going to where the physicians are to meet with them and work with them. So I've given talks for Binaytara talks in Fresno, California, in Central Valley. A year ago I was at the Anchorage Summit in Alaska, and I think it was wonderful because for me it actually allowed me a chance to meet all these doctors who I've been texting with, as I alluded to earlier. All of a sudden I meet them face to face. So it was really nice, both for them and for me. And I think that bond that we have, that we're both taking care of our patients, and myeloma is a complicated disease, helps because they don't mind texting me or calling me or emailing me later to say, hey, I have a patient, do you mind if we discuss them? So I think it's very helpful to establish those bidirectional bonds. Because on the flip side, I have patients who are airlifted in from Alaska, come here to Seattle in the hospital, and they're diagnosed with myeloma, but I can't take care of them forever. They live in Alaska, and knowing that doctor in Alaska and having met that doctor in Alaska is helpful. So I think just the location of the summits is very useful. I think on top of that, I think the every time that I give a talk for post-ASH or post-ASCO or post-EHA, for any of the Binaytara talks, they've really had an emphasis on what are the real world takeaways from this, right? We don't need to know all the data for new phase 1 trials. What does an oncologist practicing right now need to know that has changed in the last year as well as this conference? And I think Binaytara Foundation does a good job of that. And so I think it's tough, yeah, because a lot of these doctors are practicing in very small centers, don't have the support that I have the privilege of having, when I can easily give by specific antibodies and CAR T. It's not about me, it's about all the nurses and pharmacists and social workers we have to make that possible. So I think the Binaytara Foundation and having these CME type talks where the people are and where the physicians are is helpful, again, mainly because it allows me to at least whatever I can help with across state lines, I'm more than happy to.
About